Number 1, these medications work. Make no mistake, my friends, the reason why ADHD medications are so commonly prescribed is A, ADHD is really common, and B, these medications work like flipping on the light switch, like adding RAM to a computer. Not only do these medications work, but they work quickly. Within 30 to 60 minutes, the brain has come online. Not everybody responds the same way. It's not always a good fit for everybody, but trust me, these medications work. Number 2, any medication that has effects has side effects. You don't have to be very good at reading to understand that the package insert on these medications has a long list of potential side effects. What you need to understand is that a medication that's dramatic in improving your child's ability to focus and attend to tasks, to bring their focus and attention online, is going to have side effects. Number 3, side effects are very predictable. Individuals started on commonly prescribed ADHD medications like Ritalin or Adderall or Vyvanse or Concerta are going to have very specific and predictable side effects. The first of which is appetite suppression. I know this is hard for you to hear. It's the most common concern that people have. I say to them, look, your child's probably not going to eat as much as they normally would. And then people immediately say, but doctor, they already don't eat. And then I take their growth chart, I turn the computer around, I show them the growth chart and say, they definitely eat stuff. Please understand that when you take an ADHD medication, your child's appetite will decrease, but only during the time the medication is effective. If it's a 4-hour medication, the appetite will be down for 4 hours. Maybe they eat breakfast, they take a medicine that lasts 3 to 4 hours, then they come up for air, they take lunch, and the same thing occurs after lunch. They take a medication, and then they come up for air after school. That's an example of a short-acting medication, but while the medications are effective, the appetite goes down. If it's a 12-hour medication, you're smart people. 12 hours of appetite suppression, but medications do not suppress the appetite before they start working. So if you take it in the morning, if you eat breakfast before, and if you supplement calories after the medication wears off with calorically dense snacks and supplements like smoothies and protein shakes, you'd be surprised how many calories an individual can consume just by drinking them. But please understand that you don't get to skip the line in regards to appetite suppression. If you're on a dose of an ADHD medication that is effective, the child's appetite will go down. Now please understand what that means is the child's growth curve reset. They don't lose all their body weight and look like Christian Bale in The Machinist. Yes, the appetite decreases, but oftentimes the growth curve resets. So if they're growing at the 75th percentile in terms of their weight, they might reset to the 50th. If you're with a clinician who's seasoned and has seen this many, many times, they will carefully monitor the growth parameters, understanding that your child will reset at a lower percentile line, which they will then follow. Another common side effect of these medications is mood. Mood can be very difficult to maintain when a medication wears off. Imagine you're at your cubicle and you're working all day. You're drinking coffee, you're working all day, you're getting stuff done, and then the coffee buzz wears off, and that feeling that you feel is a little bit what it feels like for a medication to come offline. The child's been productive, they've been performing, they've been getting their work done all day. When they come home from school and their ADHD medications have worn off, now is not the time to give them a bunch of low preference tasks. That doesn't mean they get a pass, that doesn't mean they get to do whatever they want, okay? It's time for you to give them space so that they can reset. Regulating mood when the medication wears off can sometimes be difficult. Sometimes the medications can be activating, meaning a child may be focused and attentive, but they might be irritable. And the third most common side effect of ADHD medications is sleep. Now, most kids who are put on an ADHD medication already didn't sleep well. So this is not a new thing. It's not a new problem. What you have to understand, and the question you need to focus on is this problem worse? If the ADHD medications that your child is taking is keeping them up at night. And what do I mean by sleep difficulties? I mean sleep onset difficulties. An ADHD medication that you take during the day is not typically the reason that your child wakes up at 2 in the morning, unless, of course, they're hungry. If you take the medications too late in the day, or if you're on a medication that lasts too long, the bedtime will be pushed back. The child will report that they're unable to go to sleep in a timely manner. This is likely a side effect of the ADHD medication. If the medications are effective, this doesn't mean you have to change them, but it means you may need to think about how to treat sleep onset. That's another video. Sometimes individuals placed on an ADHD medication can experience an increased level of anxiety. Understand that individuals with ADHD have a ton of comorbidities, whether it's a learning difficulty irritability or oppositional behaviors or anxiety, it's possible that some of these difficulties could get worse. So as a parent, as a teacher, as a provider, you have to ask yourself, is the juice worth the squeeze? Is the metric of school performance, focus and attention, and success within the classroom worth the side effects that we are experiencing? Sometimes a little bit of increase in anxiety can be problematic and needs to lead us to discontinue these medications. Sometimes a little bit of increase in anxiety can lead us to pay more attention to the details, to follow through on timelines, and get our work done in a more timely and effective manner. Sometimes I see kids that will skin pick. They'll chew their fingernails, they'll pick their skin. It's the same issue. We have to watch that closely, make sure those things don't become infected, make sure that the anxiety has not increased to the point where it's not even worth optimizing their attention during the school day because they're anxious, their weight is down, they're skin picking, they're just not doing well. Those are things to watch for that are also side effects that can lead to the discontinuation of these medications. Number 4, if your clinician prescribes an ADHD medication, it's likely that they won't exactly know the availability of that medication at your pharmacy. You can ask, you can call ahead to the pharmacy before you come to the visit. You can explore your options and have ideas about what you think might be best, particularly if you have a family member or you yourself have been maintained on a specific ADHD medication that's been beneficial. It's not wrong to let your clinician know, but understand that even if you tailor the treatment to something you think might be effective, it's very possible you won't be able to find the medication. In our clinic, we're sending this script to one pharmacy, and then the family calls and says, they don't have it, can you send it here? And then we send it to another pharmacy, and then they say, well, they just ran out. And then all of a sudden, you're sending it to all these different pharmacies because there is a dramatic shortage of ADHD medications in the United States. Number 5, these medications do not need to be lifelong or every day. Oftentimes when I prescribe these medications, this is the one thing that families most want to know. Do I need to take this every day? I don't feel comfortable doing it on the weekends. And I say, listen, when you're in your house and you go into a room, you have a choice. Do you want the lights on in the room or do you want the lights off in the room? ADHD medicines work very similarly. Now, please understand that this depends on the dose, how long the individual's been on the medication. And this is a conversation you have to have with your primary care provider. But in general, these medications are effective during the day that they are used. You do not need to take these medications for weeks for them to build up steam. It's not like trying to navigate an ocean liner, which is big and slow and steady. It's like driving a jet ski. You start it up, you go, you turn around, you come back. ADHD medicines, it's a lights on, lights off situation. On the weekends, you don't have to take these medications, but also understand that if you're on very high dosages, it may not be advisable to go from 40 milligrams of Adderall XR to 0. Again, that is a conversation you need to have with your provider. You don't always need to think about these medications as daily medications. That being said, most children continue to take these medications daily. Why? Because they stinking work. Not only are these medications not necessary on a day-to-day basis, but they're also not necessary for the rest of life. If you check out some of our other videos, we've been very clear about when to start medications, but also when to stop. Sometimes individuals' life circumstances have changed. They're no longer required to sit at a desk and listen. They're actively engaging in high preference activities with continuous feedback. At that point, it may be very likely that individual no longer needs to take these medications. So if your child has been prescribed a medication, these 5 things are true. Calm down, go through these steps, think about these issues, and understand what will come next. If you're wondering, well, which ADHD medicine is best? What should I ask about? A long-acting, a short-acting, a Ritalin product, an amphetamine product? What do we do? That's the next video.